My name is My name is Christy Fujio. I'm the executive director and a co-founder of Synergy for Justice. So the first thing I should mention, I think probably you just heard the prompt, but this webinar will be recorded, which would be great. We'll later, following up probably in a couple days or next week, we'll share that recording link with you so you can share it with any colleagues who or friends who are not able to join us today. So as you know, today we're going to be talking about intergenerational trauma. We have a fantastic panel that's comprised of all of the authors and contributors to a recent article that we just put out on intergenerational trauma. The link to that article will be shared in the chat, so please take a look at that when you get a chance, and again to share it with friends and colleagues. We're really proud of this report because it's covering an important topic for all of us who work in different contexts where there's, war, post-war, any sort of violence, conflicts or contexts. Intergenerational trauma is something I think we've all heard of, but maybe don't understand very well. And so we wanted to put together both a webinar and an article that was not too academic, that was not too long, dense, or heavy, but something that was really accessible for people so that they would be able to read it, without taking hours and hours, without having a psychology degree or something like that. But they could learn some important lessons that they could use for themselves in their practice with their colleagues, friends, and family. So we have just an hour today, so we're going to get right into it. But first, let me mention that we have allotted time at the end to do question and answer. But as you guys know, sometimes there's more or less time to do that. So we'll try and get to all the questions. At the bottom of your screen, you should see a Q&A box, and that's where so you can put any questions in there. You can put the questions in starting now, or at any point during the session, you can put questions in there. And then after we hear from all of the panelists, we'll go to those questions and try and answer them. Please do, if you want to or are able to direct your question to a specific person, then it helps us a little bit better to move through the Q&A period. So with no more commentary, let me just dive in and introduce to you Dr. Dina Al-Shafi, who is the main author of the article. Dina is a psychiatrist. She's been working with Synergy for, I think, almost a decade. It's been our pleasure to have Dina as a key contributor in many of the different activities that we've done over the years. Dr. Al-Shafi has been working with asylum seekers and refugees who suffer from torture, sexual violence, and other ill treatment for more than 20 years. She's fluent in Arabic and in English. Dr. Al-Shafi is an expert in training doctors, lawyers, mental health professionals, judges, and other people on the Istanbul Protocol about how to document sexual violence and torture. She's been very active with us working in the Syria context again for about a decade, I think, helping train practitioners on how to do documentation for accountability and also how to do this in survivor-centered and trauma-informed ways. So with that, I'm gonna just start asking you questions, Dina. I hope that's okay. The first question is, what does current research, what does current research tell us about the biological and psychological transmission of trauma?
First of all, thank you very much for your introduction, Christy. And I want to thank also the 4 contributors to the article. Without them, I wouldn't be able to have written this article by myself. I'm going to answer your question for the biological and psychological impacts. So when we talk about how trauma is inherited from one generation to another, we have to think about different things. First, the biological transmission, how is it transmitted intergenerationally, and psychologically. For biologically, when we think about a pregnant mother, for example, you have a fetus in her womb, and she went through maternal trauma, whether it's war, conflict, displacement, migration, any sort of sexual violence, domestic abuse. So she goes through these prolonged sense of fear, of stress, anxiety. And so her stress levels and stress hormones in her body increase. Like, for example, the stress hormone, the cortisol level increases in the brain, in her brain. And when the fetus is the in utero environment is very critical. Not only does it feed on nutrients from the mother, but it also feeds and gets from to develop its brain the hormones that are present in the mother. These hormones, if they're increased or suppressed, they make changes in the brain development of the fetus. So when the child is born, certain changes in the brain lead to different responses, emotional dysregulation, heightened sensitivity to stressors, um different anxiety disorders, mood disorders. And as the child grows into older ages, then these mood disorders and anxiety disorders are more prevalent. I'm going to talk a little bit about a scientific bit, but I'm going to make it as simple as possible. So in our brains, we have these two almond-like shaped structures called the amygdalas. The amygdalas are in the temporal region, so up inside the brain, and they're responsible for fear-related situations. It's very crucial for our survival. When we are subjected to traumatic experiences or fear, the amygdalas are the ones in charge of balancing the situation, being able to overcome this fear. But when the stress levels are increased in the brain of the child, then these stress responses become dysregulated, leading to other issues. For example, heightened sensitivity to stressors, or inability to communicate, make normal friendships in school, later in life, socially become socially withdrawn, maybe also learning disabilities, no focus, no memory. And so the amygdalas do not work alone. They will also work with the prefrontal cortex, which is the bit of the front of our brain. The prefrontal cortex is responsible for decision making, for impulse control, and for emotional regulation. And together with the amygdala and the prefrontal cortex, they work together. So if there are any alterations in the functions of these structures in the brain, then the person starts getting psychological disorders later in life. So we have the biological part and how it affects the child psychologically. Also, after the baby is born, if there is maltreatment, if there is physical abuse, if there is neglect, how does this affect the child? If the maternal trauma that the mother suffers from, the trauma she's suffering from, did she bond properly with her child? Was there the trauma was excessive? It's unresolved. She's still suffering. There are lots of unmet needs in her life. There is stigma, there is guilt, there is blame. How does this affect the child as he's growing up? Does he feel socially withdrawn? Does he feel he needs? Is there some sort of aggression? Is he in trouble? Does he, in normal situations, how does does the child interact with when he's in trouble? Does he fight with other people? Does he have impulse control? For example, if he's in a shop and he likes something and he can't afford it, does he steal? So these are all different psychological and mental health disorders that people can suffer from.
Thank you, Dina. Yeah, I must admit, when I was reading the article, the biological impacts were something that really struck me because it was something that I didn't have familiarity with. And so it's very interesting to hear about that and to read in the article as well. Let me follow up with another question. So how does culture, displacement, migration, how do these different external factors impact the intergenerational trauma?
Sorry, can you repeat, Christy, please?
Sure, absolutely. How do culture, migration, and displacement impact intergenerational trauma?
So for the first part, you said culture. So culture when intergenerational trauma goes from grandparent to parents and then to children, there is a different culture throughout the generations. So the grandparents, maybe through historical trauma, they feel stigma. They don't talk about their trauma to the parents who will have children. So there is this stigma. There is this feeling that if I talk about what happened to me during the war, then it can affect my child. But maybe if it was more open and more dealt with, it would have a more understanding of intergenerational trauma, because the intergenerational trauma is through epigenetic markers changing without changing the DNA sequence itself, but it's like markers. So let me give you a very simple example. If we all are doing the same dish, we're all cooking the same recipe, but Christy, you put extra salt, I put less salt. For example, Maris puts more pepper. So we all have the same exact dish, but everyone puts different amounts of salt and pepper. And so this is exactly what happens with the DNA. The DNA is still the same, the recipe is still the same, but the cortisol level was increased in this brain, or it was suppressed in that brain. So how, if we are talking about different situations that our grandparents went through, culturally they would be unable to regulate their emotions. They're constantly under stress. And so there is feelings of stigma, there is feelings of fear, and different situations like that. In migration as well. With migration, there is the moving from one place to another. And is the movement talked about with the children, with the parents, from the grandparents, and this also creates silence. And the silence does not allow people to talk about their inner fears or inner things that they are not sure of. The child is not sure of. So basically, this is.
Thank you, Dina.
Hard.
So you touched on the kind of the silence and the secrecy in terms of culture and displacement. Do you want to say a little bit more about in what ways do silence and secrecy actually affect healing?
If people don't talk about their issues and find solutions to get better, then there is nothing then to talk about. But if they normalize things and say we went through war, we suffered a lot, we went through sexual violence, then it would allow a more normalizing and talking about suffering in a more accessible way.
Absolutely. Thank you. And I think this is a lot of the work that we've been doing with the stigma toolkit is trying to normalize, to destigmatize, so that people will talk about it. There won't be this culture of silence and secrecy so that people can move forward. All right. Well, thank you so much, Dina. And perhaps we'll get back to you in the Q&A session. But for now, we're going to move on to one of our other experts, Vanessa Suleimani. Vanessa is a survivor advocate and public speaker specializing in intergenerational trauma, transitional justice, and child-focused recovery. As the first child of Kosovo to speak publicly about the intergenerational impact of conflict-related sexual violence, she's dedicated her work to breaking stigma and creating spaces for healing and understanding. For over 15 years, Vanessa has navigated her own journey through mental, physical, and emotional recovery, transforming that experience into purpose and advocacy. Her work has taken her from Kosovo to international platforms such as the International Criminal Court, the PSVI conference, Brave Movement, and other platforms where she shares survivor-informed perspectives to inspire systemic and social change. Vanessa is also a key member of our survivor expert roster and was a key contributor to this article. So with no more commentary, let me just turn over to Vanessa with my first question, if that's okay. So Vanessa, can you tell us how can justice institutions better recognize and respond to the intergenerational impact of conflict-related sexual violence, particularly on the children of survivors who often remain invisible within support and reparations frameworks?
Thank you so much for that introduction, Christy. That was very sweet of you. So thank you again for having me on this webinar. It's such a privilege and honor to be contributing to something so impactful and important. For the first question, I would like to start off with how deeply personal this question is to me. I am a second-generation survivor of conflict-related sexual violence from Kosovo. And when I was 4 years old, I witnessed my mother being raped in front of me by soldiers. While she was the direct victim of that violence, I grew up living within its consequences. What happened that day did not end that day. It actually followed me throughout my whole entire life, into my adolescence and into my adulthood. But it also followed us into our homes, affecting everything that a normal person would do, making it abnormal. It not only lived within myself, but it lived in my mother's fear, in the silence that surrounded what was happening, and in the anxiety that became a part of my daily life. When we talk about justice, we often focus on the person who experienced the violence directly. And yes, this is extremely essential. But if we do not create and we do not teach that violence does not stop at the very first person, we are affecting not only families, but children and communities and entire generations. As a child, I didn't understand what I witnessed, but it carried through me in everything that I did. In my later lives, when I was 14 years old, I was diagnosed with anorexia nervosa and then later with bulimia nervosa, which led to me having a severe eating disorder for 15 years. Although that was an extremely hard thing to go through, I also realized that there was no framework that recognized someone like me, that recognized someone affected by conflict-related sexual violence secondhand. I believe justice institutions can respond better by expanding their understanding of who is impacted, who in the whole is impacted, who was there, what happened. Children of survivors, we are not seen and we are not heard, but we remain extremely invisible in these recognitions. Recognition does not mean taking attention away from the direct survivor. It just means that we acknowledge the full reality of the harm. A truly survivor-centered approach should include mental health support for families, trauma-informed services, and policies that recognize the intergenerational consequences of violence, but also have the children involved in these policy makings, not just have legal frameworks made without the people actually there, without the people who had witnessed this trauma. Because without us, why is there a policy being made? Why are we not at the table, but we are on the menu? That is a quote I've heard before. If we address only the survivor's pain, we risk overlooking the ways of trauma and the way that it shapes generations, shapes communities. As Dina mentioned, it is through biology even that we are affected. Thank you.
Thank you so much, Vanessa, and thank you for sharing the personal story and the impact that it had on you. I know it's not easy, but it helps us understand much more the impact when we hear directly from someone and how it impacted their life. So a follow-up question for you. What role can legal professionals and justice institutions play in breaking cycles of silence, stigma, and inherited trauma, and ensuring that healing and recognition extend beyond the individual survivor directly affected to also to the affected families and to future generations as well?
Thank you for that question. And this is touching a little bit on what Dina said about how silence causes a huge amount of secrecy, not just in culture, but in societies in general. So I think one of the most damaging legacies of related sexual violence is the silence. It is the fact that we carry this silence with us because we are made to believe it's wrong to talk about, or it's embarrassing, or we're going to bring shame to our families name or our country or um, that aspect of the silence. In many societies, survivors carry not only trauma, but they also carry the stigma. That stigma often extends to families, communities, and other generations. For many years, personally, I believed that this pain that I had to carry had to be quiet. It made me extremely weak, but through my healing, I've realized that speaking is not weakness, it is healing. Justice institutions have an important role to play in changing the reality. Legal professionals can help break the cycles of stigma by adopting trauma-informed approaches, by listening without judgment, recognizing the effects of violence often extended beyond the individual survivor, and most importantly, like always in the justice courtroom, not alone. It's also ensuring that no child grows up believing that what they carry is themselves. Children are not just witnesses to the past. We are the gateway to a new future. If we create a space for us to be understood and to speak and to heal, we can begin to break cycles of silence, stigma, and injustice using judicial actors as one of the key roles, role-playing people. Thank you.
Thank you so much, Vanessa. Really appreciate again you sharing your story and being with us today. So again, let me just take this opportunity to remind all of our attendees that you can go ahead and put questions in the Q&A box. And again, please do if you're able to address the question to someone specific if that's appropriate. So we're going to move on to our next panelist. That's Maris Musanovic. So Maris is an attorney and transitional justice practitioner with extensive experience in war crimes accountability, victims' rights, and judicial reform across the Western Balkans. His work included monitoring war crimes proceedings, assessing judicial practices, contributing to legislative reform, capacity building, as well as policy development to enhance compliance with international human rights standards. Maris has also specialized in reparations for victims of war crimes and torture. He managed and coordinated numerous reparations proceedings, drafted legal submissions and policy proposals, as well as engaged in strategic advocacy to improve legislative frameworks governing victims' rights. Maris, over to you.
Thank you, Christy. Good afternoon, everyone. It's a great pleasure to be with you today. I would like to use this opportunity, first of all, to thank Synergy for Justice for inviting me to contribute to this article that inspired today's webinar, as well to participate in this important discussion. I speak today from two perspectives. One as a legal professional who has spent many years working with survivors of war crime, and second as a child survivor of war. Those experiences have led me to the same conclusion that trauma does not end when violence ends, and justice systems cannot fully deliver justice unless they understand its lasting impact on survivors. For many survivors, a courtroom is much more than a place where evidence is examined and judgments are being delivered. It can be a place of recognition and healing, but on the other hand, it can also be a place where harm is unintentionally reproduced. That's why trauma-informed justice matters, Christy.
Great. Thank you so much, Maris. Let me dive into the first question for you, if that's okay then. Could you please give us one concrete example of a common court practice that perhaps unintentionally re-traumatizes survivors and what a trauma-informed alternative would look like?
Well, thank you for this question. So, one of the things that come into my mind is definitely repetitive questioning. So, as we know through criminal proceedings, survivors are often required to recount the same traumatic experience on multiple occasions, first to the police officers, investigators, prosecutors, and ultimately before the courts. While each of these interviews may have a legitimate purpose, the cumulative impact on survivors is often overlooked. For a survivor, recounting a traumatic event, the most traumatic thing that has happened to them, is not simply remembering it. Very often it means reliving it. And what may appear for legal professionals like judges and prosecutors as a routine procedural step can for the survivor feel like repeatedly returning to the worst moment of their life. This is particularly evident in cases that are related to sexual violence or crimes committed against children. Trauma also affects memory. Survivors may remember certain details with remarkable clarity while struggling with dates, chronology, or some less important details like marking on a uniform of an army. They may disclose information gradually, appear emotionally detached, or recount events in fragments. In reality, all of this may be indicators of trauma. Particular care is also required when adults are called upon to testify about atrocities that they witnessed as children. Fragmented recollection, uncertainty regarding timing may simply reflect the reality of recalling traumatic events that they experienced through the eyes of a child. A trauma-informed approach does not mean lowering evidentiary standards in the criminal proceedings or combating fair trial rights. It means creating conditions that allow survivors to provide their best evidence. In practice, this can be very simple as clearly explaining the procedure, allowing breaks to the witnesses when they are needed, avoiding unnecessary repetitions, using respectful language, and recognizing that memory gaps or emotional reactions may be normal trauma responses. So for me, a key takeaway would be a survivor should never leave a courtroom feeling the justice process harmed them more than the crime itself. Thank you.
Absolutely. Yeah, really important conclusion you made there, Maris. And I mean, all of the points that you raised, I think, are something that many of us take for granted about the difficulty in memory and not having perhaps a coherent story and timeline and narrative. But I know this is something that we all do a lot of advocacy and capacity building with people outside who are not used to it because they expect these straightforward narratives, which just don't exist, right? So thank you for raising those points. And so a follow-up question for you. What's the single most important change that a judge or prosecutor could make tomorrow to start practicing trauma-informed justice?
Well, according to me, this answer to this question is super simple. It requires no additional budget. It requires no legislative reform or institutional restructuring. It requires a simple change in perspective. Instead of asking ourselves, why is this survivor behaving this way? Maybe we should ask, what has this person experienced and how might that experience affect their behavior in courtroom today? This single shift can change how we interpret silence, fear, memory gaps, emotional reaction, delayed reporting, and apparent inconsistencies. For many survivors, entering a courtroom is not a neutral experience. It may require reliving events that have shaped their lives for decades. As someone who has experienced war as a child, I know that trauma does not necessarily disappear with time. Many people from my generation continue to carry these invisible consequences and scars that long after the conflict ended. So sometimes survivors remember not only the outcome of the case, but they also how they were treated throughout the legal proceedings, whether they felt heard, whether they felt respected, whether they felt that the institution recognized them as human beings. Uh, for this to happen, judges and prosecutors, they do not need to become psychologists. However, they need to have a basic understanding of how trauma affects human behavior. Because trauma-informed justice, it's not merely about compassion. It's about fairness, it's about improving evidence, and it's about strengthening the trust in institution. Ultimately, it's also about ensuring that justice contributes to healing rather than unintentionally reproducing harm. So, thank you.
All right, all right. Thank you so much, Maris. Really helpful points that you raised there. And again, I encourage anyone who has any particular questions for Maris, please go ahead and put those in the Q&A box. And sorry, my little friend T'Challa is hungry. So we're going to turn next to Aina, please, if that's okay with you, Aina, if you're ready.
Yep.
So
Yep.
we have here Aina Jusic. She's a Bosnian human rights advocate whose work centers on justice, equality, and the rights of marginalized communities, especially children born of war and survivors of sexual violence. As president of the Forgotten Children of War Association, she has led national and international advocacy for recognition and reparations. Aina is also a key member of our Synergy Survivor Expert roster for the Stigma Toolkit for Justice. She's a main contributor to this article as well. With a background in psychology and a passion for transformative storytelling, Aina bridges activism, academia, and art to challenge stigma and drive systemic change. Her efforts have earned her multiple international awards for courage, peace building, and human rights leadership. Aina, we're so happy to have you here today, and I will just dive into the first question if you're ready.
Yeah. Thank you.
Okay, great. So you were born from conflict-related sexual violence, a reality that many legal systems were never designed to recognize. What does institutional invisibility do to a child's sense of identity and belonging?
A lot. But okay. Hello, everyone. Thank you for having me today. And yeah, Christy, with your question, I think we can start with the main message that institutional invisibility teaches a child that their existence is a problem no one wants to address. So when you are born out of wartime sexual violence, the violence does not end with the act of itself. It continues through the silence, and it continues when there is no legal system, legal category that reflects your reality. There is no policy that recognizes your needs, and there is no institution prepared to answer the most basic questions about identity, belonging, and rights. And then through the family perspective, social perspective, as a child, you learn very quickly that certain questions cannot be asked. You learn that parts of your story make people kind of uncomfortable. You have to learn that society often sees you as a reminder of crime rather than as a person with rights and dignity. So, with this all forms of this invisibility, we have some profound consequences. Identity is not formed in isolation, it's shaped through the recognition. So we understand that we understand who we are through our families, communities, and institutions. But when institutions refuse to acknowledge your reality, they create uncertainty about where you belong or whether you matter. So for many children born of war, this led to shame, social exclusion, discrimination, and also deep mistrust of authority. All these stuff directly affects access to education, documentation, healthcare, family relationships, and overall participant in a public life. It also creates barriers in seeking justice because people are reluctant to approach institutions that have ignored them for years. When we mention legal perspective, institutional invisibility is not simply a social issue, it's a justice issue because systems fail. Whole group of people, they fail to understand the harms of the group of children born out of war. So on the end, I know that from my personal perspective, recognition, it cannot erase or delete trauma, but recognition matters because it restores visibility. In that way, we send a clear message that the harm occurred, that it has consequences, and those consequences kind of deserve a legal response.
Thank you so much, Ina. All the points that you raise, I think, are so important and not well understood at all. So I thank you for raising them. I know that for me personally, I've learned so much from you since you've been on our Survivor roster expert, and I hear the same from my Synergy colleagues. So thank you for continuing to share this perspective and help people understand what it means. A follow-up question for you. For children born of conflict-related sexual violence and survivors, recognition is often delayed by decades, as you know. So, what does meaningful justice look like when legal acknowledgement comes too late for childhood, but still matters for dignity?
Um, kind of hard question, meaningful justice. Even justice that is delayed cannot give someone back their childhood. It cannot erase everything that I mentioned before, all these unanswered questions, all this opportunity that were lost because institution failed to act. And that is a one reality. We have to be honest about that. But also, I think that in the terms of justice for children born out of war, first of all, is it's meaningful because you bring children to visibility, to the light, and that is the moment. And also, when institutions acknowledge you and respect you, that is the crucial point in which you can start social work, trying to explain society that you are not child of enemy, that you are not just reminder of something that is that happened. And also, I think that with the justice, I will touch a bit on what Mary said. This stuff can be really maybe possible if we have a justice actor who really understand trauma-informed approach. Sometimes, when we talk all the time, it would be very nice that children born of war or survivors have justice actors who really understand, who do not take emotion as a lack of credibility in our stories. And that is really something that is going on. We have to be kind of, honest in this. But I think that one of the proof of children born out of war is that justice can like directly talk about the original crime, but also it cannot be fulfilled if we don't talk about intergenerational consequences, like also Vanessa mentioned. So when we recognize both war crime, intergenerational consequences, then we can move a bit further in a process of enabling the full transitional justice processes to enable the truth that is really important for next generation to understand and to not exclude anyone just because of something that they survive, but they never choose to survive, this kind of stuff. So yeah, I'm gonna stop there. Open to more questions.
All right, great. Thank you so much, Ina. Yeah, absolutely. People can put questions in the chat and we will, or in the Q&A box, sorry. And we'll see when we get to that session. Thank you so much for sharing your experiences and your perspectives. Okay, so we're going to move now to our final survivor expert. We have Elizabeth Atieno. Elizabeth is a women's rights activist, a Pan-African feminist, and a survivor advocate. Her work is deeply informed by her personal experience as a survivor of conflict-related sexual violence and as the mother to a child born of rape. Her journey of pain, resilience, and transformation drives her commitment to advancing justice, dignity, and reparations for survivors and their children. Elizabeth's advocacy focuses on survivor-centered approaches, inclusive policies, and accountability mechanisms that not only challenge stigma, but also promote healing. She's dedicated to ensuring that survivors and children born of sexual violence are recognized as agents of change and rights holders, rather than mere symbols of tragedy. Elizabeth is a key member of our survivor expert roster for the Stigma Toolkit for Justice, was also a key contributor to this article, and we're proud to work with her and learn from her all the time. Elizabeth, welcome. I'm going to just dive into my first question for you. Actually, we have just one question for you, but you'll take your time allotted to answer it fully, as I know you always do so well. So here's the question. What would it take procedurally or legislatively, for courts to genuinely hear children rather than simply allow them to be present?
Thank you so much, Christy. Can you hear me?
Yes, perfect.
Oh, thank you. I first of all really want to apologize for coming in a little bit late.
Okay.
It has been quite a hectic day. I got to the location of the meeting a little bit late, but first of all, want to really thank Synergy for Justice, Lisa, Mira, Christine, for the kind of support that you people have given me lately. Because of the situation that I've been facing, and I don't take anything for granted. Moving very quickly to the question, Christy, would you please repeat the question again?
Sure,
you.
absolutely. And don't worry about being late. You're totally fine. I know things can get hectic. So,
Yeah.
what would it take procedurally or legislatively for courts to genuinely hear children rather than simply allow them to be present?
First of all, for me, it's about understanding. It's about understanding that these children, they are also human beings, and they are children just like any other children, just like every children that has been given birth by a mother and a father. And that the fact that they are somehow born differently does not necessarily mean it makes them lesser human. And it doesn't take their voice away. And the fact that they are children doesn't mean that their rights are taken away also. So for me, it means that the court, first of all, needs to have an understanding that these children are also survivors in their own rights, right? The same way we advocate for survivors of sexual violence, their mothers, is the same way that these children are also survivors. So for me, the day the courts in the world will understand that children born out of sexual violence, the children who are witnesses of sexual violence in conflict, are also survivors, I think it will close in the gap for them to understand that they also deserve justice. And justice can only come when these children are able to speak for themselves. The way I'm given platforms to speak for myself, the way I'm given spaces to speak for myself, the way I'm given opportunities to speak for myself, the way I'm given chances to speak for myself and tell my story is the same way these children are supposed to be allowed to be are supposed to be allowed to tell their stories, to speak for themselves, to stand in the gap for themselves. For me, I believe in self-agency. And I always like using one word that nothing for us without us, right? And for me, nothing for children born out of rape without them can be possible. And for the longest time ever, so many things are being done lately because back in the days, nobody was talking about children born out of rape, right? Nobody was talking about children born out of rape, of sexual violence in conflict. It is just the other day, if I am not wrong, that people started talking about it. And I want to really thank Synergy for Justice for amplifying this issue and bringing and giving it a global platform. So for me, the most key important thing that should be done is for these children to be given an opportunity to speak for themselves. Let me take, for instance, now one time Brooklyn wanted to share her story. And she was not allowed to do it because they said she's underage and that people will come after her. People demoralize her. People say stuff that she shouldn't hear. But at that time, she was very ready to speak for herself. She was ready to petition the Senate to give her mother the right that she deserved for whatever thing that she went through. And she was not given that opportunity. So for me, the day the courts will understand that this is also a human being, that the fact that she's a child doesn't make her a lesser human being, it will make sense. The day that they will understand that the same pain the mother went through, the same trauma the mother of the child went through, if the same pain that this child went through, if the same trauma that this child went through, the day that they'll understand that, they will give opportunities to these children because they deserve that opportunity to speak for themselves. Wait a minute, who will advocate for them if not for themselves? Who will speak for them? Who will tell the truth? Who will tell the stories for them? Who will tell that story for them? If not by
Oh,
is for these children to be given the opportunity to speak for themselves. That for me is what matters a lot. That the day they'll be given an opportunity, that platform, they'll be given the chance. They will be given the microphone to share their story, not just in the global platform, but in the courts as well, to testify against perpetrators of impunity in the world. That is where the change will start. But until that day, we're still in waiting. Thank you so much, Christy.
thank you so much, Elizabeth. As always, you speak with such knowledge and passion and experience, lived experience of what you in Brooklyn have gone through and continue to go through. So thank you. Thank you so much for that. Um, so we've gone through all, we have a little bit of time left now. This is actually perfect. Always when you have these webinars, you're worried that you're going to run out of time when you get to the Q&A, but we have enough time. So we have some questions. I'm going to pose a question first to Maris, and then we have a couple of questions for Dina, and then we'll go on from there and see what else we get to. So Maris, here's the question for you from Jenna. Do you have any thoughts on how a country in a post-war state can address the need for reparations in a transitional justice policy while also navigating the economic consequences of the war?
Thank you for this question. I think reparations are the most challenging question when it comes to the transitional justice, but also the most important and relevant one because they are the most victim-centric ones. I think that navigating, rebuilding the societies and countries after the war with a limited funding can be quite challenging, but I also think that this economical impediment should not be an excuse not to provide reparations to the victims. And this can be done in numerous ways, in the sense of identifying the priority victims and then chronologically making an order in how these
No,
reparations
no,
would be fulfilled.
Elizabeth.
We had some
Go ahead, Maris.
discussion how these reparations would be fulfilled. But for me, reparations are absolutely necessary in any post-conflict society, but we should not also minimize or put these reparations on the financial aspect also, because if we talk about financial aspects of reparation, like what is an amount of money enough to compensate someone you've lost? So they are more about acknowledgement, acceptance. It's more about being held responsible for the harm that has been done. So from this side, and it's also like we very often talk when we talk about transitional justice is also about reconciliation, but for me it's more about rebuilding trust and coexistence. How can we trust each other? And for this, reparations could be a great starting point. So reparation, in short, definitely, and through different types of economical plans, I think that they should be incorporated hand in hand with rebuilding the society after the war. Thank you.
Great. Thank you so much, Maris. Dina, I'm going to turn over to you, and we have two questions. Let's see. Do you like me to ask them together, or shall I ask you one answer and then the second one answer?
Ask me the first one and then the second one.
Okay.
I'll answer
All
the
right.
first one and then
Okay, the first question. What's the best approach that we can design to approach relapse in trauma after sexual violence? Mm.
Okay. Just like Aina and Elizabeth and Vanessa mentioned, it's about communicating of sexual violence, but any sort of violence or trauma anyone is enduring by education, by speaking up, and there should be some sort of a trauma-informed education in schools where you can address issues that cause trauma to children. Community-based initiatives providing mental health, being able to recognize as a school teacher or as someone working in the legal system, being able to understand what is behind this trauma, how the trauma happened, what is this person going through, whether it's a child or a mother, recognizing signs and symptoms of trauma, and then through whether it was sexual violence or any sort of violence. So it's about communication, education, understanding what's trauma-informed justice, and being able to act in a trauma-informed approach from the legal side as well.
Thank you, Dina. And I guess, I mean, as you're talking, I'm thinking also reducing the stigma as well, as we've talked about so much about how stigma can cause the trauma, can sort of aggravate or relapse, I think, and the silence and secrecy around that. Is that right?
Yes, talking about it, normalizing it, and saying we have been through a traumatic experience, many traumatic experiences, not one, and we're still living it, but through family communication and family members and the different communications that happen, encouraging open communication is always best in order to address problems like that.
Great, thank you. And the second question is right up your alley, as you've been working in this field for more than 20 years. So the question is, what is the role of health professionals in helping healing and offering trauma-informed care?
So the role of health professionals is crucial because we understand the biology of our bodies, whether they're mental health professionals or physicians. And by that, we have to inform others and educate others that trauma-informed approach is, just like Maris mentioned, it's a way of seeking justice. And that's the healing bit. If you have justice, then you feel that you got your dignity and your pride to some extent restored. So health professionals also have a very critical duty to educate legal justice people, transitional justice lawyers, and all these that only think on a legal side, but do not think that the child has been undergone feelings of fear, feelings of stress, worrying, whether they're unable to talk to their children, to their parents, and expressing their fears. This is very important. If a child cannot run to his mother or father and express his fears, then it's internalized, and therefore it accumulates, and therefore leads to many issues. So educating health professionals to educate other non-health professionals would definitely make a difference.
Great, thank you, Dina. Vanessa, would you like to jump in and add a bit more to this question as well?
Yes, thank you so much. As someone that has been through the health system, actually specifically in Canada, something that I would really like to add about what health professionals can do to help stop relapse in trauma after sexual violence, but also what their role in the healthcare system would be is asking questions. So I know that in my experience, none of the psychiatrists or psychologists I had until I was in my late 20s asked me even where I was like from, how I came to Canada, why I came to Canada. And I was diagnosed at such a young age. So it was more of a me versus them system rather than them trying to help me understand why my coping skills were what they were, why my eating disorder was the thing that helped me through the deep amount of stress and trauma that I was going through. So I think it's very, very essential that all healthcare providers are educated on their patient, are educated on what's going on around the world. I was a refugee in Canada, but obviously I became a Canadian citizen, and that was overlooked. Just the fact that I was a refugee, came from Kosovo, that was a really war-torn country. And also, I know Aina said it, yes, empathy is important, but it's not everything that matters. And in the courtrooms, in the judicial systems, I consider them like healthcare providers. If they don't treat us like we are human beings, why would we want to open up or tell them about our experiences that we deserve to tell? So through my experience, feeling so unworthy of my own self because of the healthcare system was such a regression in my recovery, but also in me speaking openly about what I had witnessed as a child. So thank you for those questions.
Thank you. Thank you so much, Vanessa, for that important personal perspective on your own experience. We're running up close to time, but Elizabeth, I do want to hear from you for the last comment on this. Please briefly, if you can add your intervention in about 1 minute. Oh, you're on mute, Elizabeth.
Oh, thank you. So, thank you so much, Christy. And I just wanted to add up to what Vanessa said so quickly, and just share that when I had a problem with Brooklyn's pregnancy, I ended up in hospital, and there is this 16-year-old who is pregnant in hospital at a very big hospital here in Kenya called Kenyatta National Hospital. And nobody asked me how I got pregnant. They just wanted to treat me. They just wanted to treat me to get well and go back home. Yet we had just experienced violence at that time. There was serious political instability that just happened a while ago after I was in hospital. And none of the nurses ever asked me how I ended up getting pregnant at a very younger age. So for me, I just wanted to concur with what my colleague Vanessa was sharing, like asking questions, like what happened to you? How did you end up here? Because I realized that for hospital mostly, especially here in Kenya, they just want to do their work, get paid, and get home. And nobody wants to know what happened to this patient. Nobody wants to follow up. I was so saddened with what I had one time when I was in hospital, and the psychiatrist, it was a psychiatrist conference, and the psychiatrists were like, we were told not to get attached with our patients. So for me, I asked them, if the president's daughter gets into the room and she is your patient, wouldn't you want to be attached to her? And they were like, yeah. So why not me? Why not me? And that really clicked something into them that I want to be sure that made them realize that at the end of the day, it's not just about doing the work, but it's about giving quality service to the patient. And quality service means asking questions of what happened to them, to allow them to open up and share their stories of where they're coming from. Because when a patient shares the story of where they're coming from, for me, it opens the door for justice. Thank you so much.
Absolutely. Thank you, Elizabeth, and Vanessa as well. Yeah, I mean, I think the irony is that, as you both mentioned, the healthcare professionals are all often too busy. They're just going about their routines. But if someone shows up in the doctor's office or the hospital, it's often at a very vulnerable time. They're not feeling well. Maybe they're catastrophically injured. They have a chronic condition. This is when they need the trauma-informed, survivor-centered approach more than any other time, right? So thank you for highlighting that. Before we close out today, I just want to mention that when you all close your browsers for the webinar, there will be a very brief survey. It's 2 minutes or less, if you wouldn't mind completing it. It really helps us to understand what was helpful and useful in this webinar and how we can improve in future webinars. So please take a look at that when you close out your browser. And I just want to give a huge thanks to all of our participants for joining us, and to all of our expert contributors who wrote this article, participated in this webinar. You can see in the chat a link to the article itself. And so please do go ahead and look at the article. As I mentioned from the start, it's a very accessible article. I think you'll learn a lot from it, a lot of things that you'll take away and be able to share with others. And so I think that is it. We will wrap up today. I hope everyone has a good rest of their Monday, and really huge thanks for being with us today.